Carpal tunnel syndrome is an extremely common condition. The median nerve is a nerve which passes through a tunnel which is formed by the bones of the wrist and a soft tissue belt of tissue which passes over the nerve. This median nerve gives sensation to these 3.5 fingers and also supplies the power, the muscles of the thumb. So carpal tunnel syndrome, pressure on this nerve can cause pins and needles and progressive weakness of the thumb itself and of the hand. It can cause pins and needles and pain which wake the patient at night. It can cause significant symptoms. Carpal tunnel syndrome is very common. It can come on for no real reason at all. It can be related to trauma, to an injury in the area. It can be related to repetitive activity, certain types of repetitive activity with flexed wrists. It can be related also to diabetes, to a number of endocrine conditions, to inflammatory arthritis. It can really just come on for no reason. Carpal tunnel syndrome, pressure on the nerve, is investigated by undertaking nerve conduction studies. If there is not such severe compression to this nerve, this can be managed with splintage, physiotherapy, hand therapy, and the patient can get a satisfactory result, even a small steroid injection around the area of the carpal tunnel. If there's significant compression causing irreversible damage to the nerve and the patient is losing sensation, developing weakness within the hand, having trouble doing up buttons, gripping things, fine motor movement of the hand, then this patient requires surgery. And the surgery is to release the nerve, to cut that belt of tissue which is compressing the nerve itself. The operation is a small scar within the hand. It can be undertaken under either local anaesthetic or general anaesthetic, or under local anaesthetic with a small amount of sedation. This is an extremely successful operation, and the surgery for carpal tunnel syndrome has well over 95% success rate, and the hand can be, in the vast majority of cases, restored back to a totally normal situation. The wound does take a couple of weeks to heal. Fine activity, keyboard work can certainly be commenced immediately. However, the scar does have to be kept clean for 2 weeks, and the patient will not be lifting heavy items for a number of weeks until the scar has totally healed and all the discomfort has disappeared. So overall, we're talking about an extremely common condition with a very successful method of treatment.